10 vegetables seniors should never eat. Health risks expose. Vegetables are widely recognized as essential components of a healthy diet, packed with vitamins, minerals, and fiber that support overall well-being. However, not all vegetables are universally beneficial, especially for seniors. As the body ages, changes in digestion, metabolism, and immune function can make certain vegetables more difficult to tolerate. Some may lead to digestive discomfort, contribute to chronic conditions like arthritis, or interfere with medications. While moderation is key, it is important to be aware of potential risks associated with specific vegetables so that seniors can make informed dietary choices that support their long-term health. One category of vegetables that may cause issues for seniors is cruciferous vegetables, which include broccoli, cauliflower, cabbage, and Brussels sprouts. While these vegetables are known for their cancer-fighting properties and high fiber content, they can also lead to bloating, gas, and digestive discomfort. This is primarily due to their high sulfur content and the presence of raffinose, a type of carbohydrate that can be difficult for some individuals to digest. Additionally, cruciferous vegetables contain goitrogens, natural compounds that can interfere with thyroid function by reducing the body's ability to absorb iodine. This can be especially problematic for seniors with hypothyroidism, as excessive consumption of raw cruciferous vegetables may exacerbate their condition. Cooking these vegetables can help reduce their goitrogenic effects, making them easier to digest and safer to consume in moderation. Another group of vegetables that may pose health risks for seniors includes nightshade vegetables, such as tomatoes, eggplants, peppers, and potatoes. These vegetables contain solanine, a natural toxin that some studies suggest may contribute to inflammation and joint pain. While the scientific evidence on this topic remains inconclusive, many individuals with arthritis or other inflammatory conditions report that reducing or eliminating nightshade vegetables from their diet leads to a noticeable improvement in symptoms. This is particularly relevant for seniors who already experience stiffness, joint pain, or mobility issues. Although nightshades are rich in beneficial nutrients, those who are sensitive to them may find relief by limiting their intake or substituting them with other nutrient-dense vegetables. Leafy greens like spinach and Swiss chard are often praised for their high vitamin and mineral content, but they can also present certain risks for seniors, particularly those prone to kidney stones. These vegetables are high in oxalates, compounds that can bind to calcium and contribute to the formation of kidney stones. Additionally, excessive oxalate consumption can interfere with calcium absorption, which is particularly concerning for older adults who need adequate calcium intake to maintain strong bones and prevent osteoporosis. While spinach and Swiss chard can be part of a healthy diet, seniors who have a history of kidney stones or bone density issues may want to limit their consumption or opt for lower oxalate alternatives such as kale or romaine lettuce. Canned vegetables, while often convenient and budget-friendly, can pose another health concern for seniors due to their high sodium content. Many commercially canned vegetables contain excessive amounts of salt, which can contribute to high blood pressure and increase the risk of heart disease and stroke. Since seniors are more likely to experience hypertension and cardiovascular issues, consuming large amounts of sodium can be particularly harmful. Fortunately, There are ways to reduce the risks associated with canned vegetables. Opting for low sodium or no salt added varieties and rinsing them thoroughly before consumption can help remove some of the excess sodium. Whenever possible, fresh or frozen vegetables are a healthier alternative, as they retain their nutritional value without the added preservatives and salt found in many canned options. For seniors managing diabetes or blood sugar-related conditions, vegetables like beets and corn should be consumed with caution. Beets, though packed with antioxidants and beneficial nitrates, contain high amounts of natural sugars that can cause blood glucose levels to spike. This can be particularly concerning for seniors with insulin resistance or diabetes, as frequent blood sugar fluctuations can lead to complications over time. Additionally, beets are high in oxalates, which means they also pose a risk for individuals prone to kidney stones. Similarly, corn is another starchy vegetable that can significantly impact blood sugar levels. While corn is often mistaken for a low-carb vegetable, it is actually a carbohydrate-heavy food that can lead to blood sugar imbalances if not consumed in moderation. Moreover, its tough outer skin can be difficult for some seniors to digest, leading to bloating, gas, or constipation. Those with diabetes or digestive issues should be mindful of their corn intake and consider alternative fiber-rich vegetables that have a lower glycemic impact. Asparagus is another vegetable that, while generally nutritious, may not be suitable for everyone. Asparagus has natural diuretic properties, meaning it encourages the body to expel excess fluids through urination. While this can be beneficial in some cases, it may also lead to dehydration or electrolyte imbalances, particularly in seniors who are taking diuretic medications for conditions like high blood pressure or heart disease. Excessive fluid loss can lead to dizziness, fatigue, and muscle weakness, increasing the risk of falls and other complications. Seniors who consume asparagus regularly should ensure they are drinking enough fluids and monitoring any potential side effects, especially if they are on medications that already promote fluid loss. Mushrooms, while generally safe when purchased from reputable sources, can also pose risks due to potential toxicity. While store-bought mushrooms are typically safe, some wild mushrooms contain harmful toxins that can cause severe illness or even death. Seniors with weakened immune systems are especially vulnerable to foodborne illnesses and should be particularly cautious when consuming mushrooms. Even commercially grown mushrooms should be properly washed and cooked before consumption to minimize the risk of bacterial contamination. Another vegetable that can pose a surprising health risk is sprouts, including alfalfa, bean, clover, and radish sprouts. Although they are often promoted as health foods due to their high nutrient content, sprouts are highly susceptible to bacterial contamination, including dangerous pathogens like E. coli and Salmonella. Because they are frequently eaten raw, the risk of foodborne illness is significantly higher. Seniors, particularly those with weakened immune systems, should avoid raw sprouts or ensure that they are thoroughly cooked before consumption to eliminate potential bacterial risks. Lastly, okra is a vegetable that can interfere with certain medications, particularly blood thinners like warfarin. Okra is naturally high in vitamin K, which plays a critical role in blood clotting. For individuals taking anticoagulant medications, Maintaining a consistent level of vitamin K in the diet is crucial, as excessive fluctuations can interfere with the effectiveness of the medication. Seniors who take blood thinners should consult with their healthcare provider about their vitamin K intake and be mindful of consuming large amounts of okra or other vitamin K-rich foods. While vegetables are an essential part of a balanced diet, it is important for seniors to be aware of how specific vegetables may impact their health. Whether due to digestive issues, blood sugar concerns, or medication interactions, certain vegetables require moderation or special preparation to minimize risks. By making informed dietary choices and consulting with healthcare professionals when necessary, seniors can continue to enjoy a nutrient-rich diet that supports their overall well-being while avoiding potential health complications. Medical disclaimer. This article is for informational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. Always consult a healthcare provider before making significant dietary changes, particularly if you have underlying health conditions or take prescription medications.